As tensions continue to flare over American law enforcement, a Michigan congresswoman tweets that it's time to do away with policing. Did she mean it? Congresswoman Rashida Tlaib is here. And the Michigan coronavirus surge threatens to overwhelm hospitals. Is the worst yet to come? Today is Sunday, April 18, 2021, and this is Flashpoint. Hi, and welcome to Flashpoint. I'm glad you're with us. Sadly, when it comes to the pandemic in Michigan, we are no better off than we were when you came to us last Sunday morning. In fact, it's gotten worse. Last Sunday, hospital administrators were having to curtail anything but very necessary surgeries and procedures. This morning, those administrators are in serious worry about where they're going to put the COVID patients who are overwhelming our systems. Governor Whitmer surprised a lot of people and pleased some of her fiercest critics, actually, by not ordering shutdowns or further protective measures, instead relying on Michiganders to do the right thing while the vaccine effort continues. It remains baffling why Michigan seems to be uniquely hit with this surge. It's not like the virus gets to a state line and refuses to cross. And I actually found it refreshing when last week Dr. Anthony Fauci told us we really just don't know why this is happening right now in Michigan. But the alarms are going off among doctors and nurses. And just ahead, we're going to talk with Carolyn Wilson, the Chief Operating Officer of Beaumont Health Systems, about this deepening crisis. But up first, we're going to talk to Detroit area Congresswoman Rashida Tlaib. She's proven to be a headline grabber since arriving on Capitol Hill, and this week she again had national attention after tweeting that with yet another black man dying at the hands of police, it was time to do away with policing and incarceration. It was insanity to those on the right, and it was even a bridge too far for some of her colleagues on the left, like Bernie Sanders. But it wasn't the only headline for Democrats this week, as a plan was put forth to add 4 justices to the Supreme Court, as was a plan to try to study the idea of reparations for slavery. A lot to discuss with Rashida Tlaib today on Flashpoint. You know, it can be difficult for the newer members of Congress to break through to be heard among 435 voices in the House. But as a member of the so-called squad, Rashida Tlaib has been a lightning rod, and she was again this week with a tweet that took aim at police violence and called for an end to policing and incarceration. That was just part of a very busy week on Capitol Hill, and I'm so glad to have Congresswoman Rashida Tlaib back with us again today on Flashpoint. Congresswoman, I appreciate the time, and right from the jump, let's start with your tweet, which obviously your usual detractors jumped all over it, but so did some of the people that we consider, I think, to be your allies, people like Jim Clyburn and Bernie Sanders. You want to explain a little bit about what it was you meant and how you feel like the reaction to it has gone?
Yeah, I think for many of us, we see continuing this investment in policing to address homelessness in our country, to address children that are struggling in school. You know, I grew up in a school where we had counselors and nurses, and now those folks have been replaced by police. And that is not helping people be safe in our country. We also have over and over again seen across the nation more Black lives killed by state-funded government. That's policing, with no sense of accountability at all. And I think for many of us, especially myself, I truly believe in investing in our communities, especially when we see budgets like $300 million for Detroit Police Department, while only $8 to $9 million for public health. And we wonder why so many of our neighbors are with COVID, or so many of our neighbors are struggling with public health issues. Our communities deserve more. We deserve an investment in our people, and not invested in criminalizing the poor and targeting people solely based on the fact that they're African American or a number of things. And that's what we continue to see over and over again across the country.
I think it's one thing to talk about reprioritization, but you represent a district that has a real crime problem. I'm not sure many of your constituents would not want someone to be there when they picked up the phone to call police.
It's interesting that I'm saying that. I'm not saying no one should be there. I'm saying, why are we having police departments show up for evictions and not social workers? Right? Why all of a sudden police are being called to a school if a child is having issues instead of somebody that might be a mental health expert? All of us deserve to be safe, Devin, and not just some of us. And I am saying that we need to stop trying to address these kinds of various issues with increasing policing. By the way, our jails are full of folks that shouldn't be in the jail, mental health folks, homeless folks. These are people that need help. But also really important here is to understand that we spend such an extreme amount on policing, but yet you just said, are we actually safer? That is the question, and experts have said over and over again, no amount of training, these kinds of approaches is changing the fact that public safety continues to be an issue. It's because we're not addressing real issues that impact people and families, especially children.
Well, but when you say an end to incarceration, are you
That's
saying
right.
that you don't think that the people who launched the attack on the Capitol, or that apparently plan to try to kidnap the governor, you don't think those folks ought to be in jail?
And see, there it is, twisting. I said incarceration. I just told folks, look at who's in jail. Right now, many people that are incarcerated are waiting for hearings because the system is so deteriorated and broken.
Absolutely right. There's no doubt about that.
There are folks that are filled in. I mean, even I was just talking to a colleague that represents Cook County, and she said, Rashida, most of the folks in Cook County jail right now are mental health, folks that are mentally ill. They shouldn't belong in jail. When I go to hospitals and I see police officers throughout the ER, I said, what's going on? And they said that they need those police officers here because they have folks that are being called on that are homeless, that are mentally ill or having struggles or whatever those issues are. So Devin, I want to invest in what I saw as a child. I want a counselor in the school. I want a nurse in the school. Shouldn't be, they all have been replaced with policing. And guess what? The school to prison pipeline is real. And I'm done trying to continue to say that we need more training. Just in Minnesota, Mr. Castle, after he was murdered by police, they spent $12 million, Devin, on training the police. And yet we just saw George Floyd be murdered in the same state that spent that much money, and then now Dante. And so I really urge all of folks to please listen to what I'm trying to convey is we can do better because all of us deserve to be safe, not just some of us. And when we continue to invest in things that are just not working and making us safe, what we end up is a system that is targeting people and killing Black lives at a higher number.
But there are thousands and thousands of interactions between the public and police that happen every day that get no attention because they go the way they're supposed to. Are you worried about painting with too broad of a brush? I mean, clearly we have too many lives lost at the hands of police, too many bad interactions. But is it all that much of a disaster as your tweet seemed to suggest that it is?
Does it need $300 million while we only spend $9 million on public health? That's the question. Yeah. Are we are we trying to police away homelessness? Are we trying to police away the ills and various issues that we continue to see in our country and even in the state of Michigan? I just want to reiterate the importance that I'm not saying that you don't deserve public safety, you do, but try to reimagine what that could look like. You shouldn't have a police officer at your door if you're getting evicted. You should have someone that possibly is a social worker, somebody that can help you. Yeah. I really believe many of these police officers and others, and I can't speak on behalf of all of them, but I bet you they are not trained to be involved in domestic abuse or violence or dealing with the various issues and problems and challenges that our school districts are facing because children are not getting the services they need. So it's really important that folks are listening to me when I say public safety means addressing some of the really chronic problems in our neighborhoods and our communities. Police officers are not the answer.
We've talked so much about how mental health is at on this program. We've talked about mental health being at the heart of so many of our problems. I want to move to some of the other issues that have come up through Capitol Hill this past week, which some of them are exactly what I think you and a number of your more liberal colleagues have been demanding and wanting, and yet you find some pushback within your own party and from your own president. This idea of expanding the Supreme Court. Generally, Americans don't love this idea, according to polls, and I think the idea among some is that it's a short way to address, or a short-term address of a problem that would go on forever, in perpetuity. And I mean, how many do we end up eventually with 50 Supreme Court justices because we just keep kind of moving up the bat to try to win the game here?
Yeah, look, our Supreme Court has been expanded in the past. This is not the first time, and it's also been shrunk in the past. But one thing I know as many of us and many folks in my community, I know for a fact, do not feel represented and feel very much that the Supreme Court as it is fair and that it really meets the demands of our democracy. And I think it's really critically important that we know that Republicans have tainted that process. They have created a system now where many of the bills that we pass in Congress now end up in the hands of the Supreme Court that make decisions on the most vulnerable, our LGBTQ plus neighbors, our poor communities, our immigrant neighbors. Even around our health care.
Congresswoman, it kind of started with Harry Reid, didn't it, when he decided that we no longer needed 60 votes in the Senate to confirm a Supreme Court justice, that it needed to be a simple majority. And I think some people say that is the cautionary tale here. Don't change the rules that you'll have to live with later when you might not like the result.
Look, you know, many of these rules are structures that have been set up actually to only help a few in our country. I want to be very specific. The Supreme Court has watered down the Civil Rights Act. People don't even realize that we can't even bring cases now forward because a number of case laws that have court cases have come out of the Supreme Court that limits people being able to push against racist policies and structures that we see now that are killing so many of our brown and black brothers and sisters across the country. I think it's really important that you are hearing and listening to why we think it's unfair and that our democracy is weakened by the fact that we don't have a much more broad, diverse Supreme Court that represents our nation. And I think folks do believe that to be the case. And this is an equal branch of government. This is a branch of government that impacts everything that the president does, what the United States Congress does. And I think we at least need to hear out and understand what it would mean to be able to increase the voices on this court that might be more reflective of the values of our country.
Let me let you address this then in a philosophical way, because we're looking at that issue. We're looking at now we've got a bill that would start to study the idea of reparations for slavery. As we look at the infrastructure, the fight over infrastructure in that bill, there are a lot of people in America who believe that the middle is lost right now and that both parties are being controlled and driven by the extremes, the outsides of the party. I think you would describe yourself as a more liberal member of the Democratic Party rather than someone who's in the American middle. I think a lot of people fear that the middle is being left behind. Go ahead. I don't want to.
Please, no, and Devin, I get that, and I want folks to stop with the labeling. I care deeply about people getting access to health care. We may not agree on the pathway of getting there. Yeah. I may be on a different timeline, but I promise you, I want you to have good health care in our country. I want you to feel valued in our country. I never want to have a woman go to a workplace and feel unsafe because she's a woman in the workplace. I don't want a child to be left at home because the family can't afford childcare. All of those things, I think we all in our nation agree we need access to those kinds of programmings and those safety nets that allow people to have access to thrive. People will label us here in Congress. And I know they weren't ready for someone like me that is moving with a sense of urgency saying our people have waited too long, Devin. My folks have blighted homes near their homes. Some are retiring with very little in Western Wayne. I talk to people all the time about this. People are living with a sense that government is not about them, that government is not about people. And all I can say is all of the rhetoric in between, that is what makes folks feel like they're not heard. But I want folks to please realize that I hear you. And I think a lot of new colleagues that are coming in, they're coming in with this lived experiences. I'm the eldest of 14. I've been taking care of people all my life. I grew up in Southwest Detroit where I graduated from high school and got driver's education, got my ID, was able to get through a Pell Grant to Wayne State University. Those are the same programs that are now gone. They're gone, Devin. And that is what's hurting my neighbors, no matter what, if you call them middle people, low-income people, whoever they are, even if they're doing well, those people still don't feel like our government, people in Congress are working for them. And it doesn't help that the majority of my colleagues are millionaires. They're in an income bracket that is completely disconnected with the pain of living check by check, of the pain of retiring with really no safety net and making sure they can afford their prescription drugs and so much more, Devin. So I just want people to know I represent the 13th district, but sometimes when I speak, I get letters from across the country saying, Please help me. I cannot believe that I have MS and I can't have quality health care in the richest country in the world.
We've got to leave it there, but I think you summed it up exactly. There's people all over the political spectrum right now who don't feel that they are being heard, no doubt about it. Rashida Tlaib, thanks so much for the time. Stay safe, and we'll talk to you again soon.
You too. Thank you.
You bet. Congresswoman Rashida Tlaib. We come back, we'll talk about the situation in Michigan hospitals. Crisis standing right now. This is Flashpoint on Local 4.
COVID vaccines are available to every Michigander age 16 and up. But if you're on the younger side, you may think you don't need to get one. The truth is, every single person who gets vaccinated helps protect the whole community. Get the facts about the vaccine.
Hi, I'm David Hall, and now is the time to refinance your home loan. Take years off your loan, lower your payment, consolidate some debt. Hall Financial's ready to help you achieve your goals. Don't miss out on historically low rates. Go to davidhallmortgage.com.
We're here for it all. Day 1 to year 100. The times you remember and things you'd rather leave behind. Standing by for the late nights, the midday surprises, and everything in between. We're here for it all, and always will be. Blue Cross Blue Shield of Michigan. Confidence comes with every card.
All for one elite team making the impossible possible. All for one innovative plan built for one cancer fighter, you. All for one goal, rising above your cancer. At the Henry Ford Cancer Institute, we're in this fight together. And at our global destination, we'll take care to the next level.
In the Supreme Court. It was a Republican-dominated Supreme Court, and I lost some of those executive powers. We do retain some powers, but we are so incredibly divided after, I think, the politics of the last 14 months. And so it is a very difficult moment where I'm still trying to get the legislature to just deploy resources that the Trump administration sent us. So what might seem like a natural thing to do is much more complicated than what the CDC might suggest when you look at the reality here on the ground.
That was Governor Whitmer on the Chris Hayes program on MSNBC Thursday evening, giving us a pretty strong clue about why there haven't been stronger measures ordered in the face of the surging virus in Michigan. Republicans in Lansing have had some success with judges in limiting her powers, and she's left to basically plead with all of us to get our pandemic act together. That can't come soon enough for the state's hospitals, some of which are now at a crisis footing, which includes Beaumont Health Systems. I'm very glad to have the Vice President and Chief Operating Officer of Beaumont, Carolyn Wilson, to talk to us about it. Carolyn, tell me a little bit about what it means when a hospital says we're at a crisis.
What it means is that we're really full. Beaumont has been committed to its communities for years and throughout this pandemic over the last 14 months. And what we're seeing is a combination right now, an increase, obviously, in the number of COVID patients, and a lot of our community people that have delayed care that are also needing non-COVID care, needing for us to say we're pretty full.
The non-COVID care part of this is everybody putting all those things off for a year, not wanting to go to the doctor, not wanting to go to the hospital. I guess we had to know that eventually that was all going to back up on us, right?
We were very, very concerned. Obviously, our clinicians stress the importance of preventative care and ongoing care of maintenance, for whether it's high blood pressure or anything else. And so we knew that in the first surge, which was different for us, people stayed home. And in a lot of ways, we told people to stay home. But now, 14 months later, a lot of our community members need care for heart disease and for cancer care and other things. And so it's the combination today.
We've talked a lot about the fact that it is younger patients now, younger than the ones that we saw coming in with COVID earlier, which is proof that the vaccine is working because it's the older folks who've had it. Are there other differences now, though, besides the age group, the demographics of it? Are there other differences with the COVID cases that are being treated now in the hospitals?
I think the biggest difference is we're seeing a lot of the cases have the variant associated with them. And what that means is it's just more contagious. And that's why we're really asking for the community to help us. Together, I'm a proud Michigander, and I know we all are. Together, we can curb this increased number by maintaining vigilance in our masks, hand washing, avoiding large groups, because the biggest difference is this new variant is just highly, highly contagious.
Yeah, I know that we're all concerned about the this vaccine hesitancy that we're seeing in some communities and some people. I'm wondering, and some people insist, especially this is on social media, that a lot of people in the medical community aren't all that interested in getting the vaccine. What's been your experience of your doctors and nurses, and how many of them are opting not to get it?
We have a majority of our team members now vaccinated, and we're really excited about that and pleased. I wish that I could report that we were at 100%, and we're not. But again, a significant majority of our team members, especially our clinicians, physicians, nurses, respiratory therapists, are vaccinated. We are very, very actively engaging with our non-vaccinated staff and answering questions, which is the same thing we would like to do for the community at large, because we are of the mind that vaccination is our long-term way, and it doesn't have to be that long, about 6 weeks post-vaccine to get that immunity level up, where that will tip our ability to stop these increased numbers. So again, answering a lot of questions. There's a lot on social media, a lot of misstatements. Yeah. We're trying to get the facts and the truth out about the safety and efficacy of the vaccines.
Is that frustrating for you to have to make that case to some of your own staff members?
I would say it's our job, right? And I think that our staff that have questions just help us understand the community's questions. And it is fair, right? A lot of us are vaccine hesitant. And so our own team are great barometers of the questions that are out there. And as clinicians and administrators, we have to honestly and transparently be able to answer those questions.
Another thing that is changing, I think, is our ability to see and sort of read the data and understanding what that means for our problem and where we're headed. For instance, we used to look at the test positivity rate. That's really high right now, but I wonder, is that still a decent metric? We're up around 18%, but with the vaccine where it is and the variant, do we need a new way of looking at how bad our problem is, or is it still the same?
We wish we had a better leading indicator, but I'm going to call it today yet our best indicator, that positivity rate. And so it is about 18% overall, as you know, in our Tri-County area, sometimes up to 20%. And so it does suggest that we still have at least a few more weeks of these high numbers of new COVID cases. And that's why we're really appreciative of these kinds of discussions, because we need everybody in Michigan to pay attention. We all want to get over this, right? We're all tired of doing the fundamentals of wearing masks, et cetera, but we need to hold together and get through this time frame until we're more of us are vaccinated.
I thought it was really interesting, the governor's remarks the other day when she was talking about a lot of the medications that people need to be receiving if they have COVID. It sounded like almost like a pharmaceutical ad. If you've got COVID, talk to your doctor about remdesivir or whatever it might be. But do you think that, are we still learning about how to treat this, or have we got it in a much better, do we have a much better handle on it now when somebody shows up at the hospital with COVID?
I would say I'm going to answer both because we know so much more than we did when we saw our first cases now about 14 months ago about the appropriate treatment, and we have more drug therapies available to us, and yet we have more to go. And again, I think what the governor was trying to say and what we would like to say is try to stay out of the hospital, right?
Yeah.
If you can. I want to be very clear. Beaumont hospitals and our other hospitals in Southeast Michigan, they're safe, and we want anybody that needs hospitalization to come in. We will find room, absolutely, and provide very safe care. Do everything you can to avoid getting COVID, first and foremost. And then when you do get COVID, we want to try to use some of the drug therapies early to treat symptoms if you have them. Not everybody does. And everything is to try to avoid hospitalization and that higher level of care.
Well, here's hoping for better days ahead. Carolyn, I know you're exhausted. We talk a lot about the doctors and nurses. The administrators are really tired, too. I really appreciate your time today. Stay safe, and we'll talk to you soon.
Thank you, and thanks for helping us get the message out.
You bet. We'll wrap things up for Flashpoint right after this on Local 4.
I was having problems with my old roof, and I needed to find a roofing company that I could trust. Roof One was just that. Their no-pressure sales approach made me comfortable.
The hardworking professional crew just finished installing a new roof using the highest quality materials, and I got the best warranty money could buy. I'm so impressed with how great it looks and how well they're cleaning up. I'm glad that I found a roofing company where professional service and customer satisfaction still matters. If you need a new roof, call the company that you could trust. Call Roof One today.
This is not just a mask. It's a bridge to better days. The path back to togetherness and protection for those we love. So until we all get the COVID-19 vaccine and build community immunity, which will take time, stay careful, mask up, and social distance. Spread hope, not COVID.
This is your moment. Your I can see the doctors I know moment. Your I've got options I can trust moment. Your I get to choose moment. This is your moment to get healthcare coverage with access to a large nationwide network. With Ambetter, you have access to the doctors you need when you need them right in your area. Get started at enrollambetter.com or call 855-680-3355.
Local news is more important than ever. Get the very latest on developments in Metro Detroit on Local 4 News first at 4, then on Inside Edition.
Duck nabbed. Why are so many ducks across America disappearing? It keeps happening. Are they tonight's pandemic dinner?
There's probably at least over 20 ducks, and they started slowly disappearing.
Then, Prince Harry's return to the USA after his grandfather's funeral. Watch the next
Inside Edition, following Local 4 News first at 4, Monday.
Wanted to quickly mention, if you missed any part of today's program or any part of a previous program, they're all for you there online. Just head to clickondetroit.com/flashpoint for today's episode and all the rest. Thanks so much for being here. Meet the Press coming up next. Have a great week, and we'll see you next time on Flashpoint.